Hi everyone, welcome back to my channel. Today we're going to talk about high blood pressure, also known as hypertension. It's a common condition that affects the body's arteries. It happens when the force of the blood pushing against the artery walls is consistently too high. Hypertension is often called the silent killer because it can cause damage to the body for years without any noticeable symptoms. According to the World Health Organization, more than 1 billion people worldwide have high blood pressure, and it is responsible for about 13% of all deaths. High blood pressure can lead to serious health problems such as heart disease, stroke, and kidney failure. But the good news is that there are many natural ways to lower blood pressure without medication. In this video, we'll discuss some effective ways to lower blood pressure naturally with food and supplements that may help. Then, we will go over some of the signs and complications of high blood pressure. First, let's talk about some of the things you can do at home to lower your blood pressure. Exercise regularly. Regular physical activity can lower high blood pressure by about 5 to 8 mmHg. It's important to keep exercising to prevent blood pressure from rising again. As a general goal, aim for at least 30 minutes of moderate physical activity every day. Exercise can also help prevent elevated blood pressure from turning into hypertension. Some examples of exercise that can help lower blood pressure include walking, jogging, cycling, swimming, or dancing. Another possibility is high-intensity interval training. This type of training involves alternating short bursts of intense activity with periods of lighter activity. Strength training also can help reduce blood pressure. Aim to include strength training exercises at least 2 days a week. Eat a healthy diet. Eating a diet rich in whole grains, fruits, vegetables, and low-fat dairy products and low in saturated fat and cholesterol can lower high blood pressure by up to 11 mmHg. Examples of eating plans that can help control blood pressure are the dietary approaches to stop hypertension, DASH diet, and the Mediterranean diet. Some foods that may help lower high blood pressure include citrus fruits. Citrus fruits are loaded with vitamins, minerals, and plant compounds that could help keep your heart healthy by reducing risk factors for heart disease, such as high blood pressure. Examples of citrus fruits include grapefruit, oranges, and lemons. Fatty fish. Fatty fish are an excellent source of omega-3 fats, which have significant heart benefits. These fats may help reduce blood pressure levels by lowering inflammation. Examples of fatty fish include salmon, mackerel, and sardines. Leafy greens. Leafy greens are a source of nutrients such as potassium and magnesium, which support optimal blood pressure levels. Examples of leafy greens include spinach, kale, and Swiss chard. Nuts and seeds. Nuts and seeds are rich in minerals such as potassium, magnesium, and calcium, which can help lower blood pressure. Examples of nuts and seeds include almonds, pistachios, and sunflower seeds. Berries. Berries are rich in flavonoids, which can help lower blood pressure. Examples of berries include strawberries, blueberries, and raspberries. Amaranth. Amaranth is a whole grain that is rich in protein, fiber, and minerals. Foods to avoid: processed items, pickles, canned soups, and extra salt. Reduce sodium intake. Even a small reduction in the sodium in your diet can reduce blood pressure by 2 to 8 mmHg. The effect of sodium intake on blood pressure varies among groups of people. In general, limit sodium to less than 2,300 milligrams mg a day or less. However, a lower sodium intake, 1,500 milligrams a day or less, is ideal for most adults. Limit alcohol intake. Drinking too much alcohol can raise blood pressure. In general, men should limit themselves to no more than 2 drinks per day, and women should limit themselves to no more than 1 drink per day. Next, let's talk about some of the supplements that might help lower blood pressure. Garlic. Garlic has been shown to lower blood pressure by relaxing and dilating blood vessels. It also has anti-inflammatory and antioxidant properties that may protect the heart. You can take garlic in the form of capsules, tablets, or fresh cloves. Coenzyme Q10. Coenzyme Q10 is a substance that is naturally produced by the body and is involved in energy production. It also acts as an antioxidant and may help lower blood pressure by improving the function of blood vessels. You can take coenzyme Q10 in the form of capsules or soft gels. Magnesium. Magnesium is a mineral that is essential for many bodily functions, including blood pressure regulation. It may help lower blood pressure by relaxing blood vessels and improving blood flow. You can take magnesium in the form of tablets, capsules, or powder. Hawthorn. Hawthorn is an herb that has been used for centuries to treat heart problems. It may help lower blood pressure by strengthening the heart and improving blood circulation. You can take hawthorn in the form of capsules, tablets, tea, or tincture. Omega-3 fatty acids. Omega-3 fatty acids are a type of fat that is found in fish oil and some plant oils. They may help lower blood pressure by reducing inflammation and improving the elasticity of blood vessels. You can take omega-3 fatty acids in the form of capsules, soft gels, or liquid. Finally, let's go over some of the signs and complications of high blood pressure. High blood pressure usually does not cause any symptoms, but some people may experience headaches, dizziness, blurred vision, chest pain, shortness of breath, nosebleeds. If you have any of these symptoms, you should see your doctor as soon as possible. High blood pressure can be diagnosed by measuring your blood pressure with a device called a sphygmomanometer. The device consists of a cuff that is wrapped around your arm and a gauge that shows your blood pressure readings. Your blood pressure is expressed as two numbers: the systolic pressure, the pressure when your heart beats, and the diastolic pressure, the pressure when your heart rests. A normal blood pressure is below 120/80ths mmHg. A high blood pressure is above 140/90ths mmHg. High blood pressure can also cause serious complications that can affect different organs and systems in the body. Some of the common complications are heart disease. High blood pressure can damage the arteries and the heart, leading to conditions such as coronary artery disease, angina, arrhythmia, or heart attack. Heart failure. High blood pressure can make the heart work harder and less efficiently, resulting in heart failure. Stroke. High blood pressure can cause blood vessels in the brain to burst or become blocked, causing a stroke. Aneurysm. High blood pressure can weaken the walls of the arteries, causing them to bulge and form an aneurysm. An aneurysm can rupture and cause internal bleeding. Kidney disease. High blood pressure can damage the blood vessels and the filters in the kidneys, leading to kidney disease and kidney failure. Vision impairment. High blood pressure can damage the blood vessels in the eyes, causing vision problems or blindness. Peripheral artery disease. High blood pressure can narrow the arteries that supply blood to the legs, arms, and other parts of the body, causing pain, numbness, or infection. Cognitive impairment. High blood pressure can affect the brain's function and memory, causing cognitive impairment or dementia. Sexual impairment. High blood pressure can affect the blood flow to the genitals, which can lead to ED in men or reduced sexual desire in women. Metabolic syndrome. High blood pressure can be associated with other conditions such as high blood sugar, high cholesterol, and excess body fat, which increase the risk of diabetes, heart disease, and stroke. These are some of the possible complications of high blood pressure, but there may be others. It is important to monitor and control your blood pressure to prevent or reduce the risk of these complications. You can do this by following your doctor's advice, taking medication if prescribed, and making lifestyle changes such as eating a healthy diet, exercising regularly, quitting smoking, and reducing stress. In conclusion, high blood pressure is a common condition that can cause serious health problems if left untreated. However, there are many natural ways to lower blood pressure without medication, and you can also monitor your blood pressure at home and consult your doctor if you have any concerns. By following these tips, you may be able to lower blood pressure and improve your overall health and well-being. I hope you enjoyed this video and learned something new. If you did, please give it a thumbs up and subscribe to my channel, and don't forget to leave a comment down below on what I should cover next. Thank you for watching and have a great day.